during this time, then you're obviously dealing with some physical symptoms, with maybe shortness of breath and feeling you have heavy breathing to type symptoms, and then also you have there's obviously a psychological effect that's playing a role as well. And can you give us an idea of how you deal with that? And it may be of value to other patients, because what you're explaining is not an unusual type of scenario for a number of patients, when the disease starts misbehaving, if you want, and maybe it's progressing. And it could be related to the treatment as well. Sometimes it's a combination of, the treatment that you're getting, that's also maybe dropping the count, but is also controlling the leukemia. And it could be related to the leukemia itself, and one has to be dealing with two factors or more. And so can you give us an idea of how you deal with these situations that you probably have to go deal with on a daily basis?
Let's start with the daily basis. So I now have, the chemo week of 5 days in a row, and then during that and the ensuing 3 weeks a month, appointments Monday, Wednesday, and Friday. The daily toll is that you wonder if you'll need a transfusion on a certain day. I mean, you're constantly trying to delay it, because it's like a criterion, right? Of the number of transfusions you have shows you how well or not well you're doing. It's that up and down or pendulum of emotions dealing with on a daily basis. You hit it on the nose for me. I mean, that happens daily. Okay. I think I have it under control, because it never goes away. To think that emotional up and down goes away, that doesn't happen. It stays with you. I just take it. It's like I find it equivalent to like quitting smoking. When you're quitting smoking, that withdrawal happens, and you just know it's impermanent. You just know it's going to go away. And same thing is with stress and the emotional toll. It goes away, and to understand that has helped me a lot. Okay, and I don't know if I should mention this, but after the viral pneumonia, that episode, I started studying Buddhism, and Buddhism really taught me this notion of impermanence. The impermanence not just of the emotion, but the impermanence of life. So it's kind of, I've applied that concept to facing this daily emotional pendulum or daily emotional ups and downs one goes through. The other part about all this is that I was telling my wife, I can use her name, Shelley, that this getting into the car and I have to drive an hour to get to Stanford, to gear up and say, to gear up for that drive and to stay at Stanford for 4, 5, 6 hours of appointments. That's how long transfusions, because the blood bank, is on campus, but it takes an hour or more to get those bags ready. I think to convey that I just call it hardship, to say this is hard to face this, like to face going there. It's so hard to tell people, especially people in relatively good health, to convey that to somebody, because I can't expect them to understand. So the other hard part in being a cancer patient And I think harder than facing the day-to-day ups and downs is that feeling of loneliness and isolation, because you can't talk to somebody about this, you know, because the responses you get are a little off. Um, I'm trying to think of an example. I've heard it all, like saying, people saying, "Oh well," or saying, "You can do it." You know, responses that are not is not what you're looking for. Do I make myself clear on that? At least you really feel, you can't turn to anybody to talk about this. At the same time, oh, it's important to keep your social relationships going. I mean, if you ask me, what are good things that happen here, is that I've been able to, or I make every effort to try and maintain my social relations with friends. I mean, you have to surround yourself with that. And at the same time, knowing you can't adequately tell them your story.
Yeah, no. So it would be. Do you ever have the feeling of well-being, in getting through this? The situation you deal with on a daily basis, and if so, what may promote that? And you've touched on that already, with feeling of friendship
Yeah.
but could you delve into that a little bit further?
Yeah. You know, when I was diagnosed with AML, and all that happened, and all the events that happened before then, I mean, I felt myself feeling enough of this. When I was in the hospital for that pneumonia episode, I told my wife to call hospice. I mean, they can't tell me if I'm going to survive this. So let's just go turn off the oxygen and put me to sleep. So when this happened in last June with AML, I really felt this, like throwing in the towel, because it was so, after all that strengthening and becoming not dependent on oxygen and trying to build up my body again, it was so deflating. I mean, that's the feeling I had. But so it's really, it was disbelief and sadness of getting AML. And I know the story. I mean, this is incurable. I'm not eligible for a transplant. A transplant will kill me because they don't want to inflame these lungs. My prognosis was, without treatment, if I let this AML go, I lived till maybe October last year, 4 to 6 months, something like that. Or not 4 to 6 months, it was less than that. I calculated October, I'd be dead. With treatment, existing treatment, I was told that reaching 3 years is rare. So the disbelief and sadness really kicked in for a while. But one thing that, just going to your question of what came out of that, I also experienced like joy-based gratitude, from people around me. It's just my family. I'm not saying, what's the word you used? I'm not saying well-being.
Well-being, yeah.
Well-being or feeling happy or no, none of that. I mean, I just felt, okay, this is it. My life's fulfilled. Out of that sadness came that. And that's how I've coped.
A couple of comments that I can make, and certainly one,
Mhm.
when you were diagnosed with MDS, it
Yeah.
just out of interest to point something out for people and for you too, I hope, with that type of diagnosis you had, is the median survival that they told you is probably correct, maybe 2 to 2.5 years. And, and going through what you have, the transplant, and the Vidasa and venetoclax and the transfusions, you in a way are doing really well despite all of these really negative setbacks and
Yeah.
it's dealing with this on a daily basis and getting worn down. But just to point out, and I think you've done giving us a really good insight into what one has to deal with for other patients to maybe learn from what you're telling us. And also one important thing for everybody is, we have to do better. We have to have patients live longer without all these complications and responding to treatment. And this is one of the important pointers as well, is that the way we can improve where we're at with treating your type of disease. In fact, for most malignant diseases, we have to be able to have patients participate in studies so we can find out what's the best treatments. What features of the disease may indicate that a specific treatment may work better or other treatment won't work, so we can tailor treatments and do better for patients.